The number of people who've died after contracting coronavirus in the UK now stands at more than 1,000, after the biggest daily increase seen so far. At today's government press conference, NHS England's medical director warned every one of us has a part to play if the UK is to keep the death toll under 20,000. 260 patients have died in the past 24 hours, bringing the total to 1,019. The majority of the deaths were in England, with victims aged between 33 and 100 years old. It comes as testing gets underway this week on frontline hospital staff in England and Scotland. With more, our health correspondent Dominic Hughes.
The logistics of setting up a new medical facility from scratch. A race against time to prepare the newly named Nightingale Hospital in East London, ahead of the coming surge of those who fall seriously ill with COVID-19. The sharp rise in today's death toll shows why these facilities are needed. The pressure over the coming weeks is going to be extreme.
When the NHS is under increased demand, as we expect, and is already happening in London, is that we're not going to be able to maintain the normal levels of staffing that we currently do. And so we're going to have to dramatically change the way that we work. So rather than one intensive care nurse looking after one patient, we're going to have to work more as a team.
New figures published today give an insight into who's being admitted to critical care units. The data covers 775 patients in England, Wales and Northern Ireland. More than half of them are being looked after by hospitals in London. Most are aged over the age of 50, and the number of men falling seriously ill was well over twice the number of women. And in virus hotspots like London, the pressure is already building. How full are intensive care units in London and around the UK at the moment?
Work is going on all over the country because, as you are also aware, the infection has spread a bit quicker in London. So we are not at capacity yet within London, but beds are being opened all the time to produce that extra surge capacity.
And a reminder that in order to keep the death toll down, this is no time for complacency.
If we do reduce the deaths to a level which is below what we initially thought, I want to be absolutely clear, that won't be because we are somehow lucky. It won't be because somehow the virus is acting in this country differently from any other country. It will be because every citizen in this country, the British public, have complied with the instructions that the government has given based on the best scientific evidence to reduce the transmission of the disease.
If the NHS is going to avoid a crisis, it will require all hands on deck. That's why the introduction of testing staff across the UK who are currently having to self-isolate, as they've already been doing in Wales, is a big step forward. Dr Arash Salah is keen to work, but a rough cough means he has to stay away, at least until he's tested. Has it been a bit frustrating then, waiting to find out whether you've got it or not?
Yeah, it's really frustrating because I know the hospital's busy. Even at this relatively early point, things are really hotting up. I know that my colleagues need me, and it's quite frustrating being sat here at home when I know I could be at work and I need to be at work.
And from the Prime Minister in isolation while he recovers from his own COVID-19 infection, a letter to every UK household this week, urging people to observe the guidelines to stay at home and protect the NHS. New hospitals, more testing. An immense effort is now underway to try and shore up the health service for what lies ahead. Well, I think the news that 260 people have very sadly lost their lives to the coronavirus in just a 24-hour period will really shock people. But that, unfortunately, is in line with predictions that the death rate will double every 3 days or so. But what we need to remember, and it's worth saying over and over again, is that 4 out of 5 people, the vast majority, will experience just a very mild form of this illness, and it's only a very small proportion of people who will fall seriously ill. Kate.
Dominic, thank you very much. Now, the government's also announced some more measures aimed at supporting businesses. Katie Prescott, our business correspondent, joins us now. So what was offered?
Yes, another day, more schemes to support business through this crisis. The first announcement we heard this afternoon was around protective equipment. So things like face masks for frontline NHS workers, hand sanitizer, all of those things that we've seen a shortage of over this past month. And what the government said this afternoon is that it's going to reduce red tape around the production of these products in order that businesses can get them to market, it says, in the next few days. So what we're going to see are companies like drinks companies, for example, that would normally make alcoholic beverages, perhaps making ethanol that could be turned into hand sanitizer. Now, the second set of announcement was around the UK's insolvency laws, so really targeted at companies that are struggling. And one of the biggest announcements there was around what are called wrongful trading laws. So these are laws which mean company directors can be prosecuted if they keep a business going when it's really not viable. And what the government's trying to do is really encourage businesses to keep trading through this difficult period and remove that fear of prosecution from company directors who are keeping their businesses going. Now, there are some who say, look, this really could be open to abuse, but in the main, most people agree that what this is going to do is stop a spike in the number of company collapses, which is, of course, what so many people fear, given how much difficulty businesses are in at the moment. And the business secretary said what he hopes is this will allow businesses to bounce back once the pandemic is over.
Katie, thank you. And more than 10,000 people have now died in Italy. 898 people have died in the past 24 hours alone. Hospitals in the north of the country are in desperate need for protective equipment as well as more staff. Jean Mackenzie reports from Rome.
A lifeline lands in Lombardy. Converted into a mobile hospital, this morning the German military flew critically ill patients from Italy's worst hit region to hospitals around Germany. Italy's outbreak has been so concentrated in the north that hospitals are struggling to cope. Dr. Constantini's was one of the first to be overwhelmed.
In my town, the situation is a bit improving. I think we are a couple of weeks ahead of the rest of Lombardy. So we now are on the plateau of the curve of new COVID infections.
At first it was beds and ventilators in short supply, but now it's people.
Nurses and doctors. Because we have some free beds inside our hospital we could use for patients because we don't have any more nurses or doctors.
Today, Italy has reached a sobering milestone. More than 10,000 people dead. After nearly 900 more deaths were recorded since yesterday. There is some hope here. The rate of new infections has slowed over the past week, an indication that this lockdown, which began nearly 3 weeks ago, is starting to work. But Italians are wary of being too hopeful just yet, with the number of deaths still coming so fast. But the government's medical researchers say these recent deaths don't mean Italy isn't making progress.
These people got the infection 2 or 3 weeks ago. So this is an image of Italy some weeks ago.
How many days away from the peak do you think that we are?
We are expecting that the peak will be in the next days.
These days will now be critical in determining whether Italy has managed to change the course of this cruel epidemic. Jean Mackenzie, BBC News, Rome.